Dr. Rishi Manchanda, is a physician, public health innovator. He's a founder of HealthBegins. As far as I know, he trained thousands of clinicians to think upstream. He called them upstreamists, which I always find to be fascinating idea and concept, not to diagnose diseases, but also to actually figure out what are the broken systems that are causing them. He worked, from homeless clinics. He led health system transformation. And most importantly for this conversation, he really stood up for justice from both exam room and the Capitol Hill. And I think, it's a real pleasure to have Rishi with us today. And in the aftermath of R1, or so-called Big Beautiful Bill, I'm not sure about that, we are here to ask him, what should we do next, and what should we explore? So Rishi, welcome, and really happy to have you today with us.
Thank you, Pedja. Good you guys.
I want to jump with the obvious question, and the format of this is we're going to have a little bit of conversation, Rishi and I, and then we will open for everybody else to ask questions. So the obvious is that R1 has passed. It hurts. And what do you think this moment reveals, not just about Congress and legislative bodies in this country, but the terrain that we are actually organizing in, like the space that we are in right now? And how do you make sense of it, like from your perspective?
Yeah, thanks, Pedja. First, let me just kind of reiterate my gratitude, and why I said yes. It's also because I'm a fan of everything that you and Sam and everybody is doing with courageous clinicians community here, and it's good to see some familiar faces on the line here, and some new ones too. It's good to be with you. I would appreciate getting everybody's kind of assessment, the way you characterize this moment. I think for me, it boils down, H.R.1 represents what is a clear platform, a policy agenda that is marked by corruption, extremism, and cruelty. And each of those we can unpack, right? Corruption, I think there are so many examples of the ways in which cronyism, the kind of regulatory and policy capture of government to be able to accelerate the transfer of wealth from the public to private pockets, especially the pockets of a very small number of already very wealthy individuals, to accelerate kind of these extractive and exploitative practices are there. And so government now is as a means of corruption. These are corrupt practices right now. And I think we haven't really used that term, I think, in recent days, but it's obvious from with so many anecdotes that it's almost boggles the mind to try to keep track with all the examples of corruption, from the acceptance of a $400 million jet, right? That's clearly a violation of the Emoluments Clause, to the ways in which government agencies now have been entirely both kneecapped and then repurposed to serve a political agenda that usurps the power of the purse from Congress, and also weaponizes the state against the co-equal branches of both Congress as well as the courts, and then extend that corruption to the ways in which other democratic institutions, including institutions of civil society, operate. So corruption is clearly, I think, something that we're seeing put forward through a lot of policy evidence, through a lot of the policies and the analysis that I think so many people have had, including, I tend to try to avoid the kind of the easy kind of trap to kind of fall into some of the broad brush analysis that I see sometimes coming out from friends on the left. I actually try to look for examples for each of these claims about corruption, extremism, and cruelty from folks from across the political spectrum who've been around for kind of decades, including those who are coming from disciplines of not just political science and kind of policy, talking heads and policy think tanks in DC, but from a variety of other think tanks and bipartisan and transpartisan kind of organizations. And so there are many constitutional lawyers across the political spectrum, in particular, who've made these claims about corruption.
Yeah.
Extremism, I think we're seeing so many examples of this. I live in Los Angeles, and so for those of you who, like many of us in LA, have witnessed, the weaponization of ICE to an extreme right now to be able to carry out anti-immigrant and very clearly racist kind of policy agendas to propose, that are way more aligned with white nationalist political agendas than has ever been seen in our lifetime, right? In the lifetime of all of us here, the closest analogs that we have, you have to find a moment for the rise of white nationalism, aided and abetted by state power, is pre-civil rights movement, and the response there. So we have in our lifetimes, I think, the most egregious forms of extremism that are now equipped by the power of state. And we see this in the targeting of vulnerable communities and the targeting of and that includes white communities, especially rural and poor kind of communities, working class communities, as of course it does in people of color and many other communities, including LGBTQ. Corruption, extremism, and then cruelty. So many examples abound by cruelty. And cruelty is the point, because through the extremism and the cruelty in particular, we're seeing the way in which fear is used as a political tool to be able to not just instill fear in those who are directly targeted, but to create a chilling effect among those who might even contemplate the idea of standing up, not just as individuals, but in totality, through the corruption, extremism, especially the cruelty and the weaponization of fear. We're also seeing, I think, the capitulation of, and in a very understandable way from a human behavior perspective, but entirely disappointing from a political perspective, we're seeing the capitulation of institutions. And the reason that worries me across the board is because through a policy agenda of corruption, extremism, cruelty, we're seeing attacks that are on the integrity of not just individuals and on communities, but on institutions. And those institutions are not just the ones that we hear about in the mainstream media, about which are really critical institutions of democracy, like that preserve the rule of law, but there's also institutions that provide access to the basic rights to health care, housing, food, etc. And that's why H.R.1 was so emblematic, I think, of this broader agenda, because it was the attack on those institutions, the integrity of institutions that preserve their access to healthcare, food, and a variety of other social services, and the very notion of what the role of the state should be. That was under attack, the integrity of our sense of what the welfare state, and I mean that in a way that we should revisit, I hope, in this conversation, what I mean by the welfare state, which is essentially a central element of an egalitarian kind of society. We see now the integrity of institutions, including those that many of us are a part of right now, under attack. So cruelty, extremism, corruption, these are the hallmarks of a policy agenda that H.R.1 is just one major example of, but not the only one.
Yeah. Rishi, I want to ask you about that. I want to double click on that because as you know, I come from Serbia, a different country across the Atlantic, but I'm currently deeply immersed in the United States and live here. But I wonder, when you say corruption, like my experience of that in Serbia and other countries in the global South is that legislatively, at least, there was always an attempt to actually not support corruption. In many of these countries, corruption is deeply present, but it's not that you try to legislate it or to try to create the conditions. At least on the face value, these governments, at least I can speak for Serbian government, is always trying to show that their legislation is not corrupted, and it's kind of like not enabling corruption. In reality, corruption is happening big time. So if I understood you well, you're actually saying that this bill, as it stands, is kind of like creating conditions, if that's fair to say, for corrupted practices. Is that true to say, or am I missing something here?
Yeah, I think so. There has been longstanding critique of the political system, policymaking kind of system, especially the capture of it by special interest groups and lobbying groups. And I'm using terms that resonate, I think, with not just with independents and the political spectrum, and have so for many decades. Trump and MAGA kind of rose to a certain kind of degree in 2016 by talking about draining the swamp, right? That was a critique of corruption, right? With their analysis of what was driving corruption and what corruption should look like. What I'm bringing forward is essentially that corruption idea and saying, well, it's H.R.1 is in many ways a representation of a corrupt system that has been in place for a long time, that continues to accelerate the capture of public finance, public dollars, taxpayer kind of monies, to be able to accelerate the redistribution of wealth into the pockets of very few, very, very wealthy, politically powerful interests that continue to kind of hoard power and capital, which is a corrupt notion because of what it means for those who have to fund that work. And that's
so it's not that it's not that it's just like the whole premise of like, oh, we're gonna drain the swamp or whatever is not there, but it's this bill is actually amplifying some of the practices that were sometimes even wrong in the to begin with.
So even if we use that frame of corruption, just to kind of double click on that really quickly, sorry to interrupt, but if we even take the kind of the narrative frame that was introduced and that is still out there that we sometimes like shy away from because we, God forbid, we use a narrative frame that maybe MAGA or some other kind of folks have used. But if just for a second we kind of say, okay, well, yeah, that frame is about corruption. All right, well, isn't the largest redistribution of wealth and exemplified by a policy, by a bill, by law now that creates tax cuts for the wealthiest and austerity for the poor?
Yeah.
Isn't that like the hallmark, the epitome of the swamp, right? Aided and abetted by backroom dealings with a small, powerful fruit. I mean, there's ways to even lean into that, and I think that's an important element of what I mean. And again, this is my assessment. The last thing I want to do is also to reinforce what I think is a sand trap that can happen in a lot of diagnosis of what's happening, and which is these are things that resonate with me: corruption, extremism, cruelty. But this is, I'm not prescriptive about it and it's saying, or restrictive,
Yeah.
it's saying, well, what are the words and the terms? How do you all? And this is why I really engage this, because sometimes it's less important to me that, you know, we agree on the right terms to diagnose this thing. It's more
Yeah,
important that we're
exactly.
in the act, that we're participating in the act of actually assessing and
Yeah.
sharing our kind of common ground and then building kind of connections among those who are equally frustrated. Some people may not use those terms that I use. They might use very different kind of terms, and
Yeah.
appropriately so, and very valid critiques. Certainly many do. Great. So now how can we be in conversation and find ways
Yeah.
to then share
Yeah.
the assessment so that we can then share purpose to be able to address that?
Yeah. The thing that is coming after it. What I really want to like double click, I still want to stay with these terms because I actually like them, like personally, especially the cruelty piece, because I want to ask you a personal question. You've been doing this work for a long time, and you and I know each other for a long time. And it's not that the health equity and this type of work was always seen as something really welcoming in this country. Like that doesn't feel like a new thing. But if you think about the passage of this bill and the current situation, and especially the cruelty part that you're describing, how does that feel like for you personally? And on top of that, like you did you're constantly in action, and that's what I'm always impressed and inspired whenever we interact. Like you are taking action all the time. Yeah, how do you make that like from feeling that cruelty on a personal level to actually taking some strategic actions that has been amazing in the last decades, I would say, not even like last few months, that they're just like amplified in this moment. Yeah. So any thoughts on just like personally how this feels for you, especially the cruelty part?
Yeah, it feel it. The feelings run the gamut, right? And I imagine that further in the line here as well, that we've all experienced the whole range of emotions from deep sadness and sorrow because we know people, like, and I don't mean abstract people, I mean like real people who loved ones, family members, neighbors, friends, patients, people we care for and serve, right? We know people who are in harm's way. And so sadness obviously is a profound emotion through that. And then it's mixed in with anger and frustration as well. For me, there's two things that I think about when I experience these kind of emotions, and especially, from Trump 1.0, but also even through the Biden years, there were moments where I felt like there were still some policies. And this is where I try to avoid going back many years. Sometimes feelings can be something that we use to process, but sometimes feelings can then turn into a way to be able to shield ourselves. Let me explain what I mean. I sometimes feel like if I'm feeling too much personally, and I haven't gone out to share my feelings with others, and more importantly, to listen, to ask, like, how are you feeling? How are you doing? And checking with others. Then sometimes these feelings, the cruelty creates a sense, the worst thing, which is isolation, right? Which is, I
Yeah.
feel alone. I feel like I'm sad. I know this, and maybe you are too, but like we feel separate from each other and somehow. So that those feelings can sometimes become a wall, right? And then sometimes there's also this phenomenon where the echo chamber kind of stuff happens, where I might be checking with somebody, not really to listen to them from an action bias, but listen to them to be able to commiserate
Mm.
and only commiserate. Commiseration is powerful. It's a necessary thing. We find solace together. And that's why we have to counteract the isolation. But commiseration without kind of an action bias, without a sense of, can we get angry together? Can we channel our sadness together into something that shows our sadness, right? In action, can we channel this? That's the thing that I worry about. And sometimes the feelings become a shield to actually, I worry sometimes like that when I'm isolated, that my feelings then allow me to go into kind of rabbit holes and just kind of self-reinforcing kind of, the doom scrolling and all these other things. And there's so many incentives right now that continue to kind of isolate us and also you leverage our feelings as ways to demobilize us, right?
Yeah.
So I think a lot about these feelings, the range of emotions that everybody's feeling, but there's this kind of voice in the back of my head oftentimes that I feel it's like, am I doing this alone? Am I feeling this alone? Let me just check against that and just ask somebody else because I know I'm not alone. And more importantly, there are others who are like, I want to know how you're feeling. And I want to know how you're feeling because of the second thing, which is then how can I help? How can we help? How can you help
Yeah.
me? How can we
Yeah.
work together in this way? So that's where I look for kind of finding strength because sometimes these feelings of cruelty lead to a place of isolation, but also demobilization or
Yeah.
uh,
I really like I've never heard that someone articulated so well that the connection between cruelty, the sense of isolation, and then kind of like experiencing grievances and anger, but in loneliness is not an effective strategy. It actually kind of like drains you from energy. But like there's something about feeling that together that kind of can shift from sadness and that feel like, am I alone in this, towards something great. And I think your recent actions, I would say, like, I already told you this, but I'm going to do it now on the record and publicly. I think, this whole idea of a protest fast and what I call the empty plate protest that you did for like in the last couple of months to actually counter this bill is an example of that. Like, is an actual personal sacrifice that you do in a community to actually start changing. And you had like quite a bit of traction with that among clinicians and public health people and people who are working with that. So what did that teach you? Like, of course, bill has passed, we know, but like, let's shift gears into what's coming next. Like, but that particular action, that tactic that you did with a lot of us signing up for that, like, what did you learn from it? Like, I'm really curious. And if you can also describe for maybe people in the call who don't know what it is, like, just what did you do? Because I thought it was really courageous and powerful in many ways.
Yeah, happy to describe the what it is before I talk about what I learned from it. So thanks, Bishop, for that. And thanks for fasting with me and others. Um, we were doing it together. So fast. So all of us here, I think, in some degree, are students of history and of kind of nonviolent traditions. I'm sure of, if you're interested in organizing in any way, if you're showing up here, if you're thinking, contemplating courage or channeling kind of frustration or whatnot into a political project, we can't help but kind of be aware of some tools in the toolkit politically, right, which include nonviolent kind of tools. So for a while in the back of my mind, I was like, I'd hear news reports of like mental health workers at Kaiser Permanente here in California who five nurses who, or mental health workers, including nurses who went on hunger strike in April. I was like, that's it. That Cesar Chavez kind of protest fast tradition is like, there's a living example of people doing this. And then I'd hear a story about, I'd have a conversation with a friend. I'd go out and talk to folks. I found a historian who wrote a book on hunger strikes, especially looking at examples in prisons. And I went down the rabbit hole of learning about that. These are things that I was just contemplating and exploring because of just my interest in this work. And I think this was a little bit of kind of back of the mind things post-election, post-November. And then January 20th and afterwards, it just started coming more to the fore of the mind. Like I kept coming back to the toolkit, that's out there and wondering how and when people are using it, how to join and support those efforts. Anyway, H.R.1, comes along in the House and then was passed. I had PTO scheduled and was going to go with my daughter, son, my wife, and I. We live in Los Angeles. We were going to a long planned trip to go to the East Coast to visit Boston and New York to see old friends and family. Go to DC for a little college tours for my daughter, who's a rising senior. And so we checked out the universities in that area. And the reason we made that trip in general is not just for the college tours, but because also I celebrated a hallmark birthday. I turned 50.
Congratulations.
Yeah, thanks. So, that birthday in particular, even if you're not thinking about it, like for me, I was like, I don't, it's just a birthday. But then I realized, well, maybe I'll use this opportunity, this gift of reflection. So I was reflecting on these things, and we finally go on PTO, and this bill is now passed, and I'm like, I feel guilty, like celebrating. Like, why am I feeling this? Like, this is my birthday, and yet I feel like it'd be rude to kind of party right now when this bill is out there. I was like, all right, well, let me not sacrifice my own joy and happiness for this, the altar of that, but let me channel it and maybe go back to that idea. So I have been talking to a few folks like Shoma and others, mutual friends that we know, and said, well, what would it look like to put together just a fast with a small group of people who are just doing this together? And I purposely tried to keep it small, like just, and the conversations I would have with folks are like, why is this a bad idea or duplicative? Like, tell me, there's enough on our plates. We're all busy. Why should we not do this? And what was remarkable to me was in each conversation, this is just before we went over on vacation, just after HR1 had passed the House and just before the Senate was kind of reconvening and picking it up. The conversations were a source of joy. The people that I talked to about this idea, like they're like, yes, this is good. Like I'd love to do this. It may not be enough. It may not kind of defeat the bill, but we should do something. And so then percolated out a bit more, drafted something in Google Docs as a campaign kind of outline, and then thought, all right, well maybe we can launch this. Which day should we launch this? We go to DC. We do some college tours around 5:30 p.m. on a Monday after seeing American University and GW with my daughter. I go over to Anthony Wright, who's the executive director for Families USA. I pinged him and I was like, Anthony, I'm in town. If you have a few minutes, 15 minutes, just to kind of chat about fasting. Um, what do you think? And he's like, come on over. We'll chat for a little bit. Turns out I've been thinking about something similar. So we sit down in his office for what was actually half an hour or so. And he said, look, Families is behind this. If HealthBegins wants to help co-sponsor this thing, let's do it. And I was like, that's all I needed. It was kind of that viral video many people saw many years ago of like that crazy guy kind of dancing. It felt like that moment.
Yeah,
I was dancing on my own, dancing on my own.
there's a second guy dancing.
So Anthony was the second dude and dancing. And I was like, all right, now how do we do this? And so I that night learned how to vibe code and created the Protest Fast website. I'm not kidding. This is how I spent my PTO, like creating this website that's in the chat there. And then we were off to the races with like quick puddles every day, every other day with the growing coalition and 12 organizations, including FRAC and many other anti-hunger organizations, faith-based organizations, including Network Lobby, which is a large organization for Catholic social justice, and Faith in Action, which is formerly called PICO, and then health organizations, including Partners in Health and Children's Health Watch and others, and Families USA kind of joined. And we knew the mantra was more is more at this point, like whatever we can do, right, to try to like push back against this. Anyway, so that was the fast. And what, in a nutshell, what it represented was using the tradition of protest fast, which is a long-standing tradition from faith-based traditions and civil rights movements. We thought that this could be a nonviolent, constructive disruption that could transform personal sacrifice into political pressure, a means of how an individual can skip a meal to be able to and create an empty plate representing that meal to symbolize a reclaiming of political voice and a way to work together with others to deliver a moral and proportional response to the harms that were threatened by H.R.1. And that was what it was. Now, in terms of what it meant for me, just should I answer that question or should I pause?
Yeah. No. Feel free to. Like, what did you learn? What I'm curious, and then we're gonna shift to.
So the nutshell is like, what I expected was the hunger. What I didn't expect was the hope fully. I thought this was a way to kind of channel this into something productive, but what I didn't really expect and what I got was hope. So we fasted to protest this bill that would rip food and healthcare for millions. But what emerged was, in conversations with the other organizers and then with individuals whose stories were shared on the site. You can see people started to share stories. We started to realize, let's collect the reasons why people are fasting, and we started to put those on the site. Through these shared stories, through people were equipping each other with courage and with facts, right? And just one example would beget another example. It was through this hunger that we were experiencing, I experienced a different kind of nourishment.
Yeah, I love that.
Right. There was a kind of almost a sacred act of mutual care that these protest fasts and other nonviolent traditions kind of can really offer that I'd forgotten about. I'd experienced many years ago when I did some protest fasts as a college student. But there's a fast is one example of an act that creates a mutual care. It's a moment where grief can remain, but makes a little way for connection. Where as I was writing down for my own reflections here for today, I was like, it also is a space in which outrage remains, but makes a little extra room for hope.
Yeah, I love that. Yeah,
right.
that is really well said because I think there's also something about reclaiming agency, because like especially in the moments where things are feeling like, oh, there's nothing we can do, like that kind of feeling that there is something you can do and there's something in your control, and that is that kind of like the sacrifice that brings, especially when it's done with the other people. It creates a sense of solidarity and hope that is not just theoretical but experiential, and that's what you created. And I really find that to be in my language, like one of the best things that I've seen out there, like in terms of not just cultivating, as you were saying, anger, but cultivating something that could turn into hope. Thank you, Rishi. On behalf of courageous clinicians community, I would say, what did you say? Like, courage is courage, courage is contagious. I think yours is definitely contagious, and thank you for taking the time and inspiring us and having this conversation.